We are a little over a week left until the quarantine rules lapse. And what is the take right now of medical experts on the country's COVID-19 situation? Let's find out from public health advocate and disaster management specialist, Dr. Mikey Vergara. Dr. Vergara, thank you so much for joining us on The Final Word. You are a disaster management specialist. What must be done right now to dramatically reduce these COVID-19 infections?
Okay, simply put, we have to mobilize as many people as we can. No? There's so much to be done. Our cases are rising every day. It almost doubled for today. There's something we are not yet doing. Okay, I will support an ECQ or MECQ. No, I think that's proper. I think it's timely. However, we cannot rely on that alone.
But isn't the government doing what it can already? That's why we're seeing the numbers rise by these huge amounts. It's because we continue to do more testing, we continue to do more tracing and isolating.
Yes. Actually, the IATF's strategy of T3, no? Test, trace, and treat is spot on. No? That's the way, that's the direction we should take. However, we should actually increase, no? or go on an offensive, a really strong offensive against this coronavirus. No?
So what kind of offensive should it be, Dr. Mikey?
Pardon?
What kind of an offensive should it be? What kind of numbers should we be seeing in terms of testing?
We should be mobilizing as many. I would like to. If I were to do it, I would ask the academe. Okay, I would ask the academe student volunteers, no, to do contact tracing for us. You don't even have to pay them. No, I was a young man once, and during the EDSA revolution, no, there was a time when there was a call to lay down your life, and I volunteered. I actually offered my life. It's fortunate that no one took it. No,
but if you will volunteer yourself, wouldn't also be putting the youth at risk here?
Well, yes, it will. It will. No, that's why you have to act properly. No, you provide them the proper PPEs, no masks, no, provide them the proper care, and they will go. And we do have to contact trace. We test, okay? We test people, good, no, the more the better. However, the turnaround between testing and contact tracing takes a long time, okay? In the last IATF meeting, it was mentioned that it would take 5 to 7 days, sometimes even 2 weeks.
So doctor, should we start wearing face masks and face shields at home? Should this be mandatory now to contain the virus?
It really depends on your home. No, how did you prepare it? No, how disciplined are the people? What are your SOPs? If you have someone at home who keeps on going out, goes to the market, grocery, walks around, no, when that person comes back, he or she is a threat immediately. Now consider them a threat. You step out of the house and you come back, you are already a threat. Everybody should wear a mask. No, again, it depends on the situation of the family.
It's a case-to-case basis, but I want to ask you now this very controversial issue that's being discussed by several doctors, and it is the antibody rapid tests. And a few doctors are saying that the government should stop using this antibody rapid tests because they're highly inaccurate and produce many false positives and negative results. Do you agree or disagree?
I disagree that we should ban it or totally forget it. No? I agree that there are problems. No? So you should be able to use it properly. No? The test is a tool. No? The art is in the user of the tool. Okay? You cannot use a antibody test to diagnose. Some people do. No, and that's when things start getting awry. No, but if you use it to monitor, then it's possible. I do a lot of monitoring for the private sector and the business sector,
Right.
and we're getting very good results.
What is the best test right now? They say, of course, the gold standard is the RT-PCR. But what
Yep.
about the antigen tests? Are
Okay.
these helpful, or are they just like
Yes.
the antibody rapid tests?
No. It's totally different. It's totally different. The antibody test is different from the antigen and the RT-PCR. No, in that the antigen and the RT-PCR, they look for the virus, no, or the antigen of the virus, no, and the the sensitivity is much higher, no, close to 99 or 100%. The problem with the RT-PCR, Rico, is the handling of the kit is more delicate than the antigen test. Okay, because you have to transport this in a cold chain, no, -8 degrees from country of source. Then it travels, gets here. Many times we just put it in a box or even in an ice box.
So it
never
is more
reaches
complex. It is a
yeah, it
lot
never
more
reaches-
complex. But
Yes,
briefly,
yes.
before we let you
Yeah.
go, Dr. Vergara, given the current circumstances, should Metro Manila and the nearby provinces stay under MECQ until the end of the month? Should we revert back to ECQ, or is it time to go back to GCQ?
Okay, that's a tricky question. Okay, because there's some economic
Repercussions.
things you have to think of. No? It will help. It will help if we stay locked down. Okay, maybe an MECQ. No. However, as I said earlier, it cannot be the only thing we do. Okay?
Right.
We really have to go on the offensive. We have to test more. We have to contact trace. No? By contact tracing, you save
Right.
the community. If you just test and treat a person, you're saving one person. But if you trace, you're saving the whole community.
That's right.
So that we have to ramp up the contact tracing.
Dr. Mikey Vergara, thank you so much for your insights.
Thank you.